What made you pursue medicine? Tell us a little bit about yourself and your journey as a pediatric epilepsy physician.
Of course. Well, first of all, thank you, Deepika, Ms. Grandi. I appreciate your efforts in trying to showcase epilepsy treatment and for reaching out to us so that we can spread some of the things that we are able to do now for young patients with epilepsy. And as to your question about my journey, I was probably lucky in that at about 13 years of age, for some personal reasons, I was very clear in my mind that I wanted to be a doctor. And at that time, I didn't quite understand pediatric doctors versus others, but it became clear as I grew up that I wanted to be a doctor for children. And during the course of my training, first in Bhopal, at Gandhi Medical College in Bhopal, in the pediatric hospital, I was just thrilled that this was an opportunity that life had given me to learn with my colleagues and my teachers in Bhopal. But then, when life journey brought me over to the United States at Mayo Clinic, when I did my training, I started becoming more and more interested in pediatric neurology and specifically epilepsy. I was just amazed at how much we could do for children with epilepsy, and also quite surprised that there was such a fear factor, apprehension about epilepsy, not just in the patients and their families, but in the medical community at large. So there was this big wide gap. On one hand, everybody's apprehensive and somewhat scared about epilepsy, and on the other hand, there's so much that can be done. Needless to say, there's a huge treatment gap because of these two diverse stances that we have in the community. So I got very fascinated about treating children with epilepsy and specifically about what we can do with brain surgery to treat children with epilepsy. So it became, it was one of those things, connecting dots. I think my path was meant for me, and it just kept opening in front of me in a way that I said, of course, this, and yes, of course, pediatric neurology, and of course, epilepsy. So I feel that I've had a lot of blessings to be able to realize the journey, and I feel that I'm living a dream when it comes to my professional life.
Wow, how wonderful. Thank you for sharing that, Dr. Deepak. I didn't realize your background also was from India, Bhopal. Can you compare? Do you have any points of reference for how epilepsy is treated in India today versus in Cleveland in US? Do you visit India often?
I do, Deepika. I was actually in India less than 3 months ago for the first ever reunion of the pediatric graduates from our medical school,
Oh,
Gandhi
nice.
Medical College in Bhopal. And
Interesting.
I was amazed at the amount of energy, the learning, the hunger to learn, and the willingness to embrace new treatments, not just in my alma mater in Bhopal, but also, talking to my colleagues in the field in India. I think India is at the cutting edge, like the rest of the world, in bringing nice, new, innovative treatments for making a difference in the lives of children with epilepsy early in their lives, really, because when you treat somebody at a young age, you impact not only the life of that patient, but of the family for life, instead of having to, deal with seizure after seizure for years and years before they finally come to treatment. So I see that India is right up there with the rest of the world, shoulder to shoulder. I think there are some levels of experience or resources that might be different, which is not very surprising. But I think that the world is so flat and so connected now that I'm not surprised that there's a lot of centers in India that do very good treatment, and we are happy to share our experiences with anybody that is interested.
Thank you so much, Dr. Deepak. That definitely spreads some hope for our patients in India and their caregivers. It's so nice to hear that India is, up there, with some of the top hospitals around the world. Can you highlight for us some of the milestones that you've seen in your career when it comes to epilepsy diagnosis, management, and just for reference, how long have you been in the field?
So I am actually proud to say that I will be close to 25
Oh
years
my gosh, so
in
that's
this
almost over
field.
2 decades. I would love to hear
Yes.
your perspective on, the changes when you started this career and now. So, what's that journey been like from a physician standpoint?
Yeah, obviously there is so many things that have changed, and it may be difficult for me to summarize everything for the purposes of our
Mhm.
talk this morning. But in general, I think one of the biggest things I have seen is that the treatment of epilepsy in children with brain surgery is a milestone that has just become more and more defined in a way that it is no longer the last treatment of choice when everything else
Mm,
has failed.
okay.
It has become more mainstream, more at the table of discussions early in the course of trying to fashion treatment for young children. So I think that is something, it's literally like this milestone is just emerging itself from the mists where it was poorly understood. It was considered like, oh, that is for later, maybe if nothing else works. Now that has started emerging in a very clear daylight that this is actually a preferred treatment
Mhm,
for the right patient. It's not for everybody. I don't want to ever say that or confuse that epilepsy surgery is the only way, but for the right patients,
mhm,
epilepsy surgery can make a world of difference, and that has become mainstream. So that's an important thing that I've seen change, and there is still room to improve, but it is a
mhm,
lot better than what it was 20 or 25 years ago. The other thing is really the innovations in technology and in research that have helped us to identify patients for the right kind of treatment. And
mhm,
just generally speaking, I think the innovations in trying to evaluate patients for surgical treatment have changed dramatically for the better. And also to identify sometimes patients who have a genetic basis for epilepsy. So the gene tests for epilepsy have also exploded in the field, which allows us to really carefully select the right patients for the right kind of treatment. So I think
mhm,
in general, I would say epilepsy surgery has become a
mhm,
milestone that is a lot more clear in everybody's mind now than it was before. Um, Advances in imaging techniques to identify the right kind of patients for epilepsy
mhm.
surgery has become dramatically better. And last but not least, the whole idea of thinking about epilepsy as a genetic disease in the right circumstance has just given rise to an explosion of our knowledge and understanding of the genetic basis, which allows us for some precision treatments for the right kind of treatment patients.
Very interesting. So I had a question. Say, a pediatric patient has been going through epilepsy. What's the process, right? From a caregiver standpoint, to figure out if they're eligible for a surgery or not, and at what point in time do they reach out to specialists, to assess eligibility for surgery and treatment?
So it's actually simpler than one might imagine. If a
And thank
child
you for
has,
simplifying that for us.
no worries. I think that is one of the challenges that we face, and the simpler ways there are that we can think about it, the more likely that these treatments would be thought of and accessed, right? So I think that if there is a child with seizures and the seizures have not responded to at least two appropriately chosen treatments in the right dose, two
Uh-huh.
appropriately chosen medications in the right dose, then we start looking at little more depth of understanding what is the basis for seizures in this given child. And if you can conceptualize the brain as the seat of the bad or the rogue electricity, which gives rise to symptoms that we understand as seizures, then the whole exercise is to understand if there is a spot, if there's a small area or a region in the brain that is the seat
Mhm.
for the rogue electricity, for the bad electricity that gives rise to seizures. And if at least two medicines have failed, and a child sitting in front of you after appropriate tests seems to be a child where we know that there is a seat, there is a small area in the brain which is
Mhm.
the cause for the seizures, Then the next step of the exercise is, can this spot be safely removed? And I think those are the three big milestones: failure of at least two appropriately chosen medications, the thought that this might be a seizure or an epilepsy situation that is starting from a small spot in the brain, and then is it safe to surgically remove it? I think if these three criteria are met, you have really identified an epilepsy surgery candidate.
Great. Thank you for sharing that and making that sound so simple. Dr. Deepak, so for patients from India, are they able to leverage technology, and do you offer second opinions? Have you seen international patients virtually to help them navigate this process?
All the time, Deepika. We have a very vibrant team that is trying to help our global patients in all parts of the world, in all countries. And this is no exception for India as well. And I think that we have mechanisms of doing virtual consults, e-consults. We have ways of sharing information, sharing data of the testing in a way that is a lot more streamlined and smooth than it used to be in the past. And again, through proper channels, if a patient or their family wants to reach out to experts at the Cleveland Clinic Epilepsy Center to understand whether their child has a specific avenue for treatment that could be thought of or may not have been explored, or if there's a specific treatment that may not be available in their neck of the woods, and they want to make an effort to try and utilize the help of the experts and the whole team at the Epilepsy Center at Cleveland Clinic, we can certainly facilitate that. My part in that role is perhaps the easier part, but there's a lot of people in the background. Literally, I mean, it's a team of teams approach, which starts from the people that receive the phone calls to the people that quickly connect them to the right set of experts. And then, of course, it is downstream from there. We allow a lot of efficiency and we put a lot of resources in making this possible. So, really, I think that in today's day and age, distances should mean nothing for being able to at least seek out opinions and advice or help about what might be the next appropriate step. And then beyond that, depending upon the interest, the inclination, the logistics, if you will, of making a travel happen, we are more than happy to help and walk along with them step by step to realize whatever the goal a certain family or a patient might have.
Thank you so much. So it's I think it's really bringing the different countries together using technology, and we've done that in other institutes, and I'm so glad to hear that we're able to also leverage similar services within the epilepsy space. What are some of the emerging trends in the epilepsy space when it comes to technology? You've just mentioned, the use of laser, and if you can just share maybe, some of the innovative techniques that may come in the future that are already not here, or, where Cleveland Clinic perhaps is doing some
No, I
research.
think that I feel that this is probably the most exciting time in my career to be in the field of epilepsy treatment for children, because there is just phenomenal explosion of knowledge, research, technology at all fronts. But let me boil it down for you. So, for instance, we talked a lot about epilepsy surgery being the treatment. I think our capacity, our abilities to identify candidates for epilepsy surgery has improved tremendously because of the investigative techniques that we have. And I think we talked about the MRI for this particular patient story. There are other steps in trying to identify candidates who might be candidates for surgery, and those are also remarkably different now than they were even 2 or 5 or certainly 10 years ago. Stereo EEG is a technique which is a very elegant technique where we can pass very thin wire-like probes into the brain without causing any adverse effect, at least there's no expected adverse effect. Surgery is a surgery, we are humble about that. But we can pass wires in the depths of the brain to sample areas of the brain that might be causing and contributing to a certain set of bad electricity and seizure types.
Mhm.
And previously, where the MRI looked either completely normal, or if the MRI had a large area that looked like it was not formed well, now we can pass these probes to identify what might be the small nest of badness or
Mhm.
seat of bad electricity with the help of stereo EEG. And that technique is technique that has been refined so much in the
Mhm.
last few years at Cleveland Clinic Epilepsy Center. And we continue to think in more innovative ways in trying to identify candidates that will be good candidates for receiving surgical treatment. So from imaging to this big intermediate step of stereo EEG, where we can pass thin wire-like electrodes to identify candidates, all the way to, let us say, tailored precision medicine.
Mhm.
Now it is so commonplace for us to be able to send and promptly receive a lot of meaningful information about the genetic basis of epilepsy.
Mhm.
And that is particularly important early in life. In young babies, when they start having seizures, we have learned so much about a big variety of genes that can actually cause their seizures. That's the first step. And already we are scratching this information to the next level of depth where how can this gene information allow us to choose the specific treatment, the specific medication that actually can modulate and control the seizures. Now, again, this journey has just started, so there's a lot to be
Yeah, so you're
realized.
talking about prediction and prevention or maybe avoidance of surgery where not needed. So it's not just necessarily surgery that you're talking about, right? With these
Correct.
advancements. That's
Right.
so promising. Sounds
Right.
very promising.
Unfortunately, everybody is not a surgical candidate, but we are able to still understand that big cohort of patients that may not be surgical candidates on the basis of whether it's a genetic basis, whether it's a precision medicine that can help them, or a specific kind of medicine that should be avoided because of certain gene defect. So all of that aspect of epilepsy has also just exploded in the last several years. And I think that we are very excited because there's a lot more to come. We should stay tuned and not give up hope on any of our children who have seizures that are not easy to control because there's a lot of hope and things that we can do.
That sounds very promising. Thank you, Dr. Deepak. And so, as we wrap up our session today, I want to ask you, as we celebrate this World Epilepsy Day, what's the key message or advice that you would like to give our caregivers, our parents of pediatric epilepsy patients?
Yeah, no, thank you so much for inviting my thoughts about this. And really, congratulations on World Epilepsy Day to everybody that cares for patients, whether it is a sibling or a family or a medical care provider that helps these children do better. My message, I think, would be to the caregivers of children with epilepsy. I would say improve your awareness
Mm-hmm.
about what can be done for seizures.
Mm-hmm.
I think there's a lot of responsible information that is on our fingertips in this day and age. And in patients or children with epilepsy, parents are just the amazing team, support cast. I would say improve your awareness and ask your doctors, what else can we do?
Mm-hmm.
Prompt them to think a little bit more.
Okay.
What else can we do? Is there a certain test that might help us appreciate or understand the epilepsy better? Is there a certain treatment if the medicines are not working? Is there possibility of a surgical treatment? Ask these questions. I think as parents of children with epilepsy, nobody would be a better advocate, a better cheerleader for your specific situation. And we appreciate, as physicians or care providers in the world of epilepsy, we appreciate such questions from families. So learn a little bit more, ask questions, and then be the strongest advocate that you can. If you've experienced a successful treatment of any kind, whether it was based on the gene defect that was found or an epilepsy surgery treatment that was crafted for your child, be the strongest advocate. We really need others to hear from you. And there is no powerful voice than a family that has been there, done that, and now got better. So I think you can be very powerful in trying to just elevate the quality of life of so many people whose lives you can touch because you have had the experience of going through it.
Yeah,
So that is my message, and I hope that it resonates with people because we really need help on all fronts. You know, at Cleveland
absolutely.
Clinic, we have done for the last almost 18 years a reunion
Mm-hmm.
of patients, of children who have had brain surgery for epilepsy. So we invite everybody who's ever had brain surgery as a child for epilepsy at Cleveland Clinic. And every 2 years, we invite these patients and their families to come because we know that they are the strongest voice to be the advocates for talking about epilepsy surgery and also understanding from each other how has life been after 6 months or sometimes 6 years or 10 or 20 years after brain surgery. This last reunion, we had somebody who came first after his brain surgery. Then he
Mm-hmm.
came a few years later with his girlfriend. Then he came a few years later with his now wife, the girlfriend that he had brought earlier, and then the daughter, and finally, this last reunion, he came with his daughter, who is now 16 years old. And he had received brain surgery how many years ago? Half of his brain had to be removed. But even with the remaining half, his quality of life just became so much better that he
Mm-hmm.
was able to realize all these important milestones in his life. So everybody was so inspired, not just the families that met him, but
Mm-hmm.
all of us every time that see. So these efforts of trying to talk and network with each other are really, really important to just improve awareness and allow more patients to be able to access this treatment.
Wow, thank you for such a strong message of awareness, message of advocacy, and message of staying empowered.